So really relax, bring that head back.
Oh my God.
Did you feel that?
What? That felt like crazy. That was like more in my neck.
Yeah, you feel the cracks.
I feel tall. I feel tall.
You can swing your legs around.
Okay.
So we are here with Ryder, aka GlitterCheeto, and she has never been adjusted before, right?
Nope.
Cool. I'm excited. So we kind of did a little assessment. Everything's looking really good, range of motion. So we're just going to see how she feels after that. She's got a little bit of tightness through the mid-trap, so we're going to kind of work into that a little bit. So I'm going to have you come onto your stomach, and you're going to look to the side a little bit right there. And we're just going to start with a little spine warm-up, some traction. Yep, that's perfect right there. So looking at hip rotation, looks good. You said you're a little bit nervous with everything, right?
I'm scared.
Okay.
I'm terrified.
So I'm gonna just kind of warm up the spine a little bit with some traction. I'm actually gonna. These are not ASMR sounds. Is that comfy there?
Mm-hmm.
Cool. So I like to start with just a little bit of traction, kind of stretching out the spine. This is actually one of my favorite things. If this is all I had without even the adjustments, I'd be a happy customer. Does this feel pretty good in the lower back?
I kind of love this.
Yeah.
It's kind of nice.
I always kind of explain it. I mean, I know you watch the videos with the Y strap and the towel.
Mm-hmm.
So we're gonna be a maybe on that one, but I kind of describe this as like the same sensation, but for the lower back.
Okay, I'm a little intrigued.
Yeah, so we're just creating like long axis traction or Y axis traction. But I like to kind of not get straight into the adjustments because it's a little scary sometimes. But I think starting with the lower back, there's maybe a little bit less apprehension. It's just easier joints to kind of work with. And as we're kind of going through it, if there's anything that feels weird or off, just let me know. There's always like 10 different ways we can do everything. So.
Okay.
Perfect. But yeah, your hips were looking good, and you said really no low back issues. When we did that assessment, this right side was a little funky. Is that more tender on the right compared to the left?
Mm-hmm.
Okay. So when she was laterally bending to the left, so kind of like that, we noticed a little pulling or stretching. Is it okay if I kind of hang here for a little bit? Okay. But as far as hips go, you're pretty flexible, so it was kind of hard to see how far the hips are off. Are you working out?
I should be.
Yeah. Playing any sports?
Nope. I've been being lazy.
It's hard as an adult.
It's really hard.
Yeah, I'm doing like the 75 hard right now.
Ooh.
So I have to work out twice, but it's like I'm on day 3 and I'm like, I don't have any more muscles to work out. Like
You're like, okay, full body again.
Yeah.
Let's just do it again.
So, cool. Well, I'm gonna steal this from you, and I'm gonna have you come onto your side facing me this way.
Okay, side.
Yeah, so your head's gonna go right there, your right shoulder's gonna go right there. And slide down a little bit. We're gonna bend this leg here, and I'm just gonna shake this way.
Am I doing this right?
Yeah, that's perfect.
Okay.
And then with the camera, since we'll cut it into like shorts, you don't have to get super close, minus the crack, but yeah. Cool. So we're gonna just take the joint to its end range. So you kind of feel that tension there. I'm gonna do a little roll and a push.
Ooh. That was scary.
That was good, though.
I liked it. Yeah.
Let's go ahead and flip on over to this side.
That was terrifying.
It wasn't too bad though.
No,
Right?
it's not that bad. Okay.
I think the videos just make it really scary.
Yeah, no, that felt
Because
great.
the audio. So go ahead and look over the shoulder right there.
Okay.
Cool. And we're gonna come up a little bit higher right here. You feel good there?
Mm-hmm.
Okay, cool. Let that air out.
Oof.
Let me give you a chance. That was great.
That was good. That was great.
Yay.
Yay.
So you're good right there, actually, if you want to keep laying on your back. So we're going to get into the mid-spine. So we're going to do a little spine hug here.
Okay.
And you can just relax back there. And these are pretty easy. You don't have to do anything except for breathe and let the air out. Good.
Ooh.
Awesome.
That was good.
Some little baby ones in there. So I'm going to come up a little bit higher. Let's see. If you could just bring your chin down towards your chest, let the air out again. Good.
Oh my god. That was a good one. That one was crazy.
Yay.
Yay. I was like, I think I just popped my boob.
We don't want that.
No.
It's a malpractice on my end, I think. I don't know.
Oh, no.
Does that happen?
No, I have no idea. Oh, this feels so good.
Cool, yeah, so I'm gonna just kind of hang here for a little bit. And before we get into the neck adjustment, I'll kind of show you what that end range looks like. We haven't shot
so great.
long form content in forever, so I'm excited to get some new videos up. Everybody's been mad at me just posting the short videos, but that's what got us to 100K.
Yeah.
And now we're at like 150. It's crazy. Woke up this morning.
Oh, really?
Yeah, it took us 4 years to get 100K, and then like a month to hit 150K.
Dude, hell yeah. Once you figure it out, it's just like, okay, this is what I'm doing.
Yeah, I think YouTube's just been pushing the shorts, but I feel bad for like all my OG followers who want like the longer content.
Well, we got them today.
I know, we got them.
Happy Valentine's Day.
It's Valentine's Day. All right, so everything so far, not that scary, right?
Mm-mm.
It's pretty easy. You have a tooth on your hand.
I do.
What does that represent?
I don't know. I just like teeth.
Okay.
And I used to be a dental assistant, so I was like, this
Okay.
is just on brand.
Yeah, that makes sense.
Mhm.
None of my tattoos mean anything.
This one, yeah.
They just look cool.
They just, right? They just look cool.
We had another patient had a tooth on her face.
I saw that one. I was
That's
like,
a super cool one.
yeah, no, it was. It's a big molar.
Yeah.
Like literally huge.
Oh, it's funny, you actually know which teeth.
I
are
know.
which. You never really think about like the like how big the tooth is. Like you just kind of you see.
Oh my gosh, one time
That
we
tooth.
took out this one guy's wisdom teeth. This bitch was like this big. I was like, how was that in your jaw?
Yeah.
It was the biggest tooth I've ever seen.
We have like an actual human skull right there. You wanna show
Really?
it? Yeah. you can
Where?
see. And so he's from like,
Oh, that's cool.
yeah, he's from like he probably was born in 1920. He was in medical school or college in the 1970s.
Uh-huh.
It's wild that his teeth are still on that. Like it's
Yeah.
so well preserved.
No, that's awesome. That's crazy. I'm gonna get an up close look at
Actually, so we'll go back again. So I'm gonna kind of show you how that adjustment works. So
Okay.
I'm not gonna do it right now, but basically we're just locking out the joint. So do you feel how that kind of tensions right there?
Uh-huh.
So we're gonna do the same thing in just a second, but seated, so we get a little bit better audio. So if you want to take a seat, and the more relaxed you can be, the easier it's gonna be, the better it's gonna feel. So if you
Oh,
wanna
is
swing the leg-
this the one?
Yeah, we're doing the one.
I'm terrified. Okay.
It's just it's like a hug for your head, and then it feels really good after. So you don't have to do anything. If you want to come a little bit closer with the audio. So that same tension spot right there, I'm gonna do a little pull. We're gonna come
That
back to that
was
spot a little
loud.
bit lower as well. So kind of let the head fall into this hand here. Good.
Oh my god.
Yeah.
That one was scary. That was awesome.
Yeah.
That was awesome.
Let's go on your back one more time. No, I feel good. I want that one.
That felt so good.
Good. So we're gonna do just a little bit more of a push onto this side here. There you go.
Oh wow.
You did it. Those are like the hardest
That
ones.
was terrifying, but so good. I'm now not scared ever again.
Yay. Do you want to do the towel now? You
I'm
trust me?
scared. We could do it. We could do it.
So I'll just kind of, again, take you to that end range and see like where it would feel. And then I just do like a little half push. Again, it looks just crazy on the internet because you got your camera in the face. So you're
Yeah.
and all that stuff. So let's just see how it feels. Go ahead and lift the head up. But again, you can always back out.
Okay.
Don't feel like because you're on camera. But what this one does, it'll kind of get this upper like back and lower neck area. So little choky and that motion right there. How's that feel?
It's not bad.
You want to go for it?
Let's do it.
Okay. Cool. So really relax. Bring the head back.
Oh my god.
Did you feel that?
What? That felt like crazy. That was like more in my neck.
Yeah. You feel the cracks.
I feel tall. I feel tall.
You are gonna be tall. Yeah.
Straight. I'm aligned.
So you're good right there. I'm gonna
Okay.
just run through all the other ones. So if you want to land back again. Cool. Did you feel that kind of go all the way down, or just like?
It was
right
more
in
in my
there?
neck,
Okay.
but it felt really good.
Okay.
It felt great.
All right.
Ooh.
Look, we got your bracelet on.
Yes, perfect.
This is its cameo. We're gonna get into the knees. Extremities, sometimes they're loud, sometimes they're not. You're too flexible for this one. Yep. I need people with more jacked up knees for that to be loud. I'm gonna slide you down just a little bit.
If I was still in the club, they'd probably be crazy. Ooh.
Jeez.
Oh, that felt good.
Yeah, that was motion. I got all the way into the hip too.
Yeah.
Too flexible there. Alright. ASMR.
Ooh.
Cool. Awesome. Let's go ahead and come on up this way. And just swing the legs around towards me. Almost done. Actually, we're gonna get into some grinding in here if that's cool with you. Okay. So we're gonna take the arm right here, and I'm gonna do a little pull upwards.
Ooh.
That was good.
That was good.
I'll do the same thing. Okay.
Oh, baby.
Go ahead and land your back one more time. All right, so we did all the adjustments. You made it through the towel adjustment.
I did the towel. I was really scared about that one.
So proud. And then you said you were down for some dry needling as well.
Mm-hmm.
Cool. There you go.
My lash is in my eye. I got it.
Need to go
right?
fix it?
Yeah. I'm blind.
Mirror's handy. 'Cause I feel like I'm always so bad, like when people's makeup are running, I'll just let them go out the door with it.
Yeah. No, don't do it like that.
That's why I have Tia. Do you ever tell people to? Are you
If I notice it.
Yeah.
Mm-hmm.
I just let them. I'm like, you look great.
And then whatever, they get in the car, they're like, that fake bitch. Like, what the fuck? No, that's funny.
Low standards.
I'm scared about my face in this video. I'm like,
It's gonna be great. So scoot all the way down.
Okay.
So your head is going right here. So we're gonna do like a really basic one for the trap. So you said you kind of had some tightness in there.
Yeah.
Let me see. Okay. And then have you? I don't think I really post any videos with the stem in there. But I'll kind of walk you through it, talk you through it as we go. So it's not like a medical needle. It's not gonna feel like sharp. We're not injecting anything, so they're really thin. It's like, have you had acupuncture?
no.
Okay.
But I do have a lot done to my face, so this does not scare me.
Okay. This is easy. This will be fun. So this is just a little bit of alcohol there.
Should I move these? Should we like do this?
You can do one at a time. Yeah.
Okay.
Okay. Yeah. If that's comfortable for you,
Yeah.
that's perfect. Makes it easier for me. So you'll feel a little twitch potentially, and you might feel like kind of a dull, achy soreness. And if you feel that, that is a good thing. So needle is in. There we go. Cool. How we doing? Not too bad? Cool. So I'm gonna hook up this little stem unit. Have you ever had like the stem unit pads? Have you ever seen on TikTok like they put the pads in the bicep and somebody will control it and they're trying to drink a drink?
No.
Okay, you'll see it now because we
Okay.
just put it out today. Essentially, this will kind of contract the muscle, so you might get some shoulder movement in there. You're just gonna feel a little heartbeat happening. So let me. Oh, that was instant. You feel that?
Oh my god, yeah. That feels crazy.
Yeah. Do you want more, or is that a good spot right there?
What do you mean more?
Like I can turn up the intensity. So.
Ooh, try it, yeah.
Okay. You tell me when.
That is crazy.
Is that good right there?
I kind of like it.
Yeah.
I like love it.
It's an oddly satisfying.
Can you see it?
Yeah, for sure. So watch. I'll slow it down so we can kind of really see that shoulder move. I prefer when it's like faster.
Ooh.
Like that.
I like this one too.
Yeah, it's between the frequency of like 1 and 16 per second is like our effective treatment dose. So what you'll see, like if there's a true dysfunction in the muscle, in the beginning, it'll kind of like twitch randomly. It'll be like really kind of off. And then after like about a minute, once all those circuits kind of get cleared out, it's like very consistent, like what we see with yours. I'm just doing it so you can experience it. We get a longer video for people to fall asleep to. When you do have something going on, so I'll get needling done in my neck whenever I have a flare up, and we'll hit the back of the vertebrae, and it kind of gets muscle tissue that you can't really reach with your hands or your fingers. So that's what I kind of use it for, is just like difficult spots like that. So
I love it.
let's get the other side so we're not looking in one direction. Just crank to the side. That felt pretty good though?
Oh yeah.
Awesome. Yeah, this is, I've had people pass out on me a little bit.
Really?
That's great. You said you're used to the needle stuff.
Yeah, that doesn't scare me.
But these are our smallest ones, so comparison to like acupuncture, like an acupuncturist, this would be like maybe their biggest needle because it's a little bit more superficial. And that's not blanket statement. There are some acupuncturists that do more of a dry needle style. So we just go a little bit deeper. So like these would be for some like pro athlete glutes, the 135s.
That goes in their glutes.
Yeah,
Are you serious?
Yeah. So we got all kind of sizes, but we got our little guys for these straps. Doing okay?
Yeah.
And then we can so it's just creating a circle or a circuit. So that's what this guy is. So we could put 2 needles in there, create the circuit, and these are gator clamps over there. But we're just giving you a quick sample, see what that feels like. Cool. Doing okay?
This one feels crazy.
A little bit more on the side. Is that good tension? You want more or less?
We can do more.
I feel like you're trying to test the limits.
I am trying to test the limits. I'm like, what's it feel like?
Here, I'm going to slow it down so you can really see. It's kind of uncomfortable when we do the slow runner.
Oh, I don't like that.
Yeah, okay, we'll speed it up.
The fast one's good. The slow one, I'm like, ew.
That's my preference. Our other chiropractor, Ben, he likes doing the slower, like 10 reps. I'm like, no, I'm not the fast.
Yeah.
So whenever I jump into his room, the settings are always
He's like,
off.
just go.
Cool. Let's take that off. And
That one was different.
yeah.
That was different.
Yeah, we have our different sides. Oh, did it feel a little spicy going in?
It felt a little spicy.
I'm not going to show it on here, but that's because I actually hit a vessel. So that's why that felt a little different.
I was like, that feels insane.
We're not going to show blood on YouTube.
You know.
That's why I got the gloves. You might actually have a little bruise there.
Oh, it's okay. That's okay.
But you did it. If you want to sit up one more time and face the window, I'm going to do a little bit of scraping so we don't get sore, and we'll send you on your way.
Yay.
So you get to experience the comedy video that we put out earlier with the Dorsa dip.
Oh, yay.
So that's on the shorts. Yeah, that video is hilarious. I'm such a horrible actor on the spot. He like really pulled through everything. Yeah, you're just like, I'm just going to sit
I was like,
here.
I'm just going to sit. I'm not going to say a word. I was just like, oh. Except for my one, I want some.
The what?
The part where I'm like, I want some.
Oh, so you do have a speaking part?
I do have one speaking part, yeah.
If you want to come around to this side so you can kind of see what I'm doing. So we have CBD with some other anti-inflammatory stuff in here, and I am just kind of scraping on the skin with our gua sha instrument. Have you had gua sha before this?
I do it to my face
Cool.
sometimes when
Yeah.
I remember.
It's the same concept. I'm pretty nice about it, so I'm not going to leave you with any bruises. I already got you good with the needle, so.
Leaving here all sorts of messed up. Just kidding.
So we're just going to get the CBD. So sometimes after getting adjusted the next day, you'll feel a little sore. So that's why I like to do a little bit of soft tissue with the adjustments, just so you don't hate me tomorrow. Put that in. But we added some peppermint in here, so that kind of gives you like that icy hot feel. It'll start to hit in a second, while staying all natural. So the biofreeze that we were showing before, that essentially the only active ingredient is menthol.
Oh, really?
So it's basically just a distraction for your pain. So it's like,
Do you want me to hold this?
you're good. Yeah, I got it. I always like working with people with like tattoos for video work, because I feel like for the audience, it's always kind of like interesting to like look at.
Oh, yeah. Everyone's like, oh my God, the tattooed chiropractor. And I was like, yeah. And they're like, wait, it's only tattooed people. I was like, not only, but it's
I know.
like, it's a good It's different.
Yeah, I've been trying. I kind of recognize that. I'm like, oh, I don't want people to think like I just work with tattooed people, but for whatever reason, that's truly like our demographic now.
Yeah.
It's like
It looks good though.
safe place for misfits, I guess.
Yeah.
But yeah, the comments are hilarious. We'll either
Remember,
get-
you're not even a doctor.
Yeah, I'm not.
We're
Just got my online certificate.
Yeah. Fuck it.
No, that's kind of the whole idea. Is this whole room doesn't feel like a doctor's office.
No, it's really cool. I love it.
Chiropractic can be one of those things where it is kind of scary, right?
Mm-hmm.
And I feel like when you get thrown into like the white coat syndrome on top of like something being scary, you get all this anxiety, and that's
I was
harder for me.
Yeah.
We threw you in with that video right away. That was...
And then I was like, okay, we're buddies, we're friends. This is not scary.
Yeah. Cool. Feeling good?
I feel
What
great.
do you need to do when you rejects? But actually, if you want to stand up real quick, you just have that one thing when you bent to the side, that pulling, is that?
It's like completely gone.
Okay.
Yeah.
I was like,
Yeah.
the only thing. We were like
Yeah.
trying to find something wrong with
There
her,
was
but-
nothing wrong. It was fine.
So, yay.
Yay! Yay! We did
We
it!
did it.
I want to see it. Can we watch it?
Yeah.